Now, I was trained in the US where we used to perform, our orthopedicians used to perform high-end procedures called Van Ness rotation plasty, where they would try to convert the ankle of the patient into the patient's knee by flipping the ankle across so that the limb is still preserved and the mobility of the patient's joint is still preserved at the knee, giving them a lot of range of movements, even if it means using a prosthesis. Where I come in as a pediatric oncologist is making sure that the right chemotherapy schedule is designed. The patient is able to receive high-dose chemotherapy, including cisplatin, doxorubicin, methotrexate, which is not deliverable in most of the centers because of the support system that's required. So, for example, high-dose methotrexate is a high-dose chemotherapy that's delivered after a lot of planning and monitoring, post which drug levels have to be monitored, patient's urine output, urine pH, a lot of important but small parameters have to be given the right attention to so that they're able to tolerate the side effects of the chemotherapy and at the same time get the benefit. So, if the patients are able to undergo a few cycles of these neoadjuvant chemo followed by salvage limb, it gives them a limb-salvage surgery, it gives them a much better outcome and a much better quality of life going forward. So let's try as a team of pediatric oncologists, pediatricians, orthopedicians to try to give these children the best outcome and quality of life possible, while of course keeping the focus on keeping them alive and safe and away from these tumors. If you have any doubts about osteosarcomas or Ewing sarcoma and the role of chemotherapy, neoadjuvant chemo and limb salvage surgery, kindly reach out to me at Apollo Hospitals, Bangalore. Thank you.